Go.
We may want to leave now. Henry Crisler, Executive Director, Mississippi Medical Marijuana Association. Henry, good morning, sir. How are you?
Good morning, Paul. I'm good. How are you? Thank you for having me on.
I'm doing good. First thing is, what were your thoughts when the news came down as far as the reclassification and exactly what was going on and what it meant and everything else? Just give me a little bit of a feel of that.
Sure. So we've been anticipating this change for about 8 months now. I still think it's not official. I think last week the announcement came from sources from the Associated Press. I'm not sure the DEA has actually made the official statement yet, but we expect them to. So the rescheduling from Schedule 1 to Schedule 3, still a little bit too early to figure out all of the ramifications for state medical programs or recreational programs, but we do think that it will be a net positive for state-run medical cannabis programs. I think
for the industry. Before you get into anything else, let me read this one because this came in the last 24 hours. The leader of the marijuana prohibitionist organization that accurately predicted last week's cannabis rescheduling recommendation now says that sources inside the Drug Enforcement Administration, the DEA, are telling him that Ann Milgram, she's the agency administrator, quote, did not sign off on the landmark decision. I can say now with full confidence that the administrator of DEA, Ann Milgram, did not sign the rescheduling order. Kevin Sabay, I think is how you pronounce it, president of the advocacy group Smart Approaches to Marijuana, or SAM, posted on social media. He did this last night, citing two confidential sources inside the DEA, and he also cited another that I found at the DEA with the intimate knowledge, which means an insider, of course. He also said a further statement relayed on the drug report, a news site published by the Foundation for Drug Policy Solutions. That was co-founded by Mr. Sabay, or Sabit, or however you pronounce his name. It's hard to overstate how deeply political and flawed this makes the rescheduling process look. DEA Administrator Ann Milgram should be commended for standing up for science and truth over the profit-driven pot industry, he said. So this thing is kind of in turmoil right now. So after that, which way does it go?
Not sure. I still think that the DEA will reschedule it from Schedule 1 to Schedule 3. I think this is a long time coming. I think it was 8 or 9 month process. But still, we probably won't see any real change for the next 3 to 6 months.
Yeah. But, Henry, if this winds up where the FDA is going to go on and study it like any other drug and it winds up in pharmacies, what does that mean to the industry, the bricks and mortar?
So I'm not really sure that the rescheduling will require dispensaries to register as pharmacies or for medical cannabis to be dispensed through pharmacies. I think state-run medical cannabis programs are already at conflict with federal law, so I don't think it's going to have any real material change on the process of dispensing medical cannabis to patients. Yeah. I do think that due to rescheduling that it will be a net positive for cannabis operators. They will no longer have to abide by the restrictive 280E requirements with the federal government.
Which means what?
So it's a tax law that if you are a retailer of Schedule 1 or Schedule 2 narcotics, that you cannot take normal business deductions on your taxes. So as a Schedule 3 drug, medical cannabis dispensaries or medical cannabis operators can start to deduct normal business expenses from their taxes, which should make them significantly more profitable, I think.
In that area, yeah.
Yeah.
Does it do anything as far as the banking regulations and cash transactions, et cetera?
I've spoken to a few bankers that operate in medical cannabis. They don't think it will have any real material change on banking. I think the Safer Banking Act and the MORE Act are more aligned with creating or eliminating the restrictions on cannabis banking. Although I do think with rescheduling, it will allow for more accredited research to be conducted. I think Schedule 1 makes it very restrictive to try and do or conduct legitimate research. So I think Schedule 3, as well as some of the state changes that we've made in the legislative session, should allow for, at least here in Mississippi, to conduct some more official research.
All right. Kind of explain on a simple basis what going to Schedule 3 means in relationship to, let's just say, any other prescription medicine. Not
So-
over the counter, but prescription medicine.
Sure. So a Schedule III drug that the federal government is recognizing that drug has some medical benefit. Usually, like you mentioned earlier, Schedule III drugs are dispensed through registered pharmacies with the DEA, but because of the already existing conflict between state and federal law in regards to medical cannabis programs, we don't anticipate that being the case, although it is still too early to tell exactly what will happen with this rescheduling.
Well, before we even get there, the FDA would have to do a great amount of study, would they not?
I'm not sure if they would have to do a lot of studying. I think the HHS has already made that recommendation to the DEA to reschedule it. And I think the executive branch and Congress have the ability to reschedule CSA restricted drugs.
Yeah.
So it could be, 3 to 6 months. It could be shorter than that. We are in an election year. I do think this is at least partially motivated to drum out support in the presidential election.
You think? You think?
I mean, I don't want to make any assumptions, but I do think that was probably a motivating factor.
How big does the Mississippi Ole Miss Research Center play into this one? They kind of get a spotlight shined on them now.
Sure. I think, we also had Senate Bill 2888 passed this year that would allow for the Ole Miss Research Center to work with medical cannabis operators here in Mississippi to conduct research. And I think this is just goes along with reducing those restrictions on researchers to conduct legitimate research on the effects of medical cannabis on debilitating illnesses and conditions.
What will it do, let's just say the major companies, the Pfizers and some of the big guys, having their research teams, you search out a certain illness or debilitating birth defect or whatever it happens to be, and then you try to find some type of medication to either cure that or alleviate the pain or whatever it happens to be. And then they do research on that. Because they're not doing that now.
Correct. Yeah, and I don't anticipate that this rescheduling will prompt them to start any research. It still is a federally illicit drug, even at a Schedule III. So I'm not sure if Pfizer or any of the major pharmaceutical companies will even be interested in it, even with the rescheduling. But one of the concerns is if they did do research and they did trademark a medication involving medical cannabis, that anyone that would want to dispense that medicine would then have to be registered with the DEA as a pharmacy. So although I don't anticipate them actually conducting any research as a result of it moving to Schedule III, we will be monitoring that closely.
I guess your phone's been busy. Because honestly, and everything you just said is absolutely true as far as we got a long way to go before it gets into a pharmacy. But that said, probably the major thing that happens is just the pall that's cast over the industry where people say, all right, hang on, do I want to go in and invest literally millions of dollars in this, not knowing if the market's going to change in 5 or 10 years? And you see that not only here but elsewhere.
Agreed. Yeah, I think, especially with medical cannabis or cannabis being a Schedule I narcotic, the effective tax rate on medical cannabis operators, for a majority of them, were close to 70%. So with it being Schedule I, it made making a profitable medical cannabis business very difficult. But I think with moving it to Schedule III, you're going to see
it's more. It's going to help a little bit, yeah.
Definitely.
I do want to ask you this as far as anything in the state legislature. We had that one bill that was background checks. I'll ask the update on that one from Henry Crisler. Henry is the executive director now of the Mississippi Medical Marijuana Association. More with Henry Crisler, executive director, Mississippi Medical Marijuana Association. Some numbers. Always like to get some progress report from you when you're on, some numbers from the industry as far as business outlets and everything else. You got some?
Yeah. So I think the last patient number I saw was this weekend. I think on Saturday, and we were encroaching on 44,000 patients. So it's well over 1.5% of the population. We're pretty ecstatic about the rate of certification. It's definitely taken an uptick in the last month or so. Business-wise, licensee-wise, I think we've sort of hit a plateau of some sort. We're right at 390 total licenses across the program. Now that changes. I mean, licenses, ownership of licenses change pretty regularly, but we're right at under 200 dispensaries. I think 130 of them are currently open. I think we have between 70 and 80 cultivators, although we have 135 of them licensed. So we have, plenty of supply and more coming online every day. So.
What about the testing? Is it still only a couple of different concerns doing that?
I think there's 4 licensed laboratories. I think 2 of them are in operation. There's another one on the coast that has been in the process of verifying their test methods for the last few months. I think they were anticipating to be open in April, but was unable to make that deadline. So I think they're close behind. I expect them to be online sometime soon.
For 44,000, what do you think the peak is in the state that you guys, when early on in doing the research here, how many people do you think the state could support as far as medical marijuana?
That's hard.
What was the figure then?
I think the original figure was around 150,000 patients. I think over 4 or 5 years. So we're right on track for that. But obviously, as regulations change and as the program hopefully expands over the next year or two, that number may increase, and the rate of certification may increase as well as the process of obtaining a card becomes easier.
While I got you on here, because we really didn't get a follow-up to that little snafu we had with some of the product on the shelves being tainted, and they had to pull it off. Where does that stand now?
The administrative hold process is over now. I think a majority of the products that were placed on administrative hold have made it back to the dispensary shelves. I think there were a few products or product lines that were no longer in production. So it made the Department of Health, it made the process of retesting those products much more difficult because all of the products were already on dispensary shelves. So they weren't able to go to a cultivator or a processor and pick up a batch or a test batch that was used to make those products. So that process has slowed down a bit, but I do think that I think it's almost pretty much over. I think a majority of those products have made it back to the shelves.
Let's talk about the legislative session. And did we finally do anything as far as gas station heroin and all that? And, how did that work out?
Unfortunately not. That bill died right at the end of the legislative session. I think, over the last month, the original bill that was proposed was, I think, 30 pages. I think it had basically tripled in size by the end of the session. I think our regulatory agents at the Department of Health and the Department of Revenue got involved just to try and square some of the conflicts with the Medical Cannabis Act and the Hemp Act. But I just think, to be fair to our legislature, going from a 30-page bill to a 160-page bill in a month, and then expecting every legislature to have enough time to read it and process it and understand it was a big task. So I understand why the bill
sounds like a process of confuse and conquer, though, doesn't it?
It's a very it was already a confusing bill. I mean, we were talking about 3 separate, distinct products that, due to lack of public education and public awareness, most lay people would just consider it all cannabis or weed. So it was a difficult process to try and explain that bill and what it did to the legislature. And I think we learned a lot this year. And I think we remain committed to advocating on behalf of a safe, regulated medical cannabis program. And that means, advocating against unregulated, unsafe products like you can find at gas stations and convenience stores.
Henry Crisler, Executive Director, Mississippi Medical Marijuana Association. We had another bill. That bill was to enhance some of the penalties. I believe, do you know where that one came out?
I'm not exactly sure. I know the only bill that, besides...
It was background checks, I think it was.
So Senate Bill 2857, I had to go speak with our regulators at the Department of Health to try and get some clarification on this. This is not one that we tracked very closely this legislative session, but according to our regulators, there was a conflict between state and federal statute in regards to background checks. And so this bill was just to sort of resolve some of those conflicts between state and federal statute. But as far as I'm aware, and I have my own work permit, this bill only pertains to work permit applicants, so people that are employed by medical cannabis entities or caregivers, but it has nothing to do with patients. Patients are not required to have a background check ran before they get.
Oh, is that right? So you don't. If you buy it, you still don't. You don't have to have a background check.
Correct.
Your doctor's okay is all that's needed.
Correct. And the Department of Health was already charging a fee for conducting these background checks. I think 2857 just sets a maximum fee of $60 on the processing of these background checks, but it should not have any real material effect on the cost of certification or the cost of obtaining medicine. But one of the positive things out of this bill, and one of the only positive things for the program that we were able to secure out of this legislative session, was the removal of the 7-day purchase allotment on patients. So before this bill, and technically still currently until July 1st, till the governor signs it and it goes into law, patients are limited per week, so they can only purchase basically a fourth of their monthly allotment every week, which forces them to go back to the dispensary every week and purchase new medicine, which is pretty time consuming and restrictive on mobility impaired patients and patients that are lives quite some distance away from their closest dispensary. So we think this is a very positive change, and it aligns medical cannabis with other pharmaceutical drugs that are dispensed in 30-day allotments. So we are very excited to have been able to secure that victory in this bill. But other than those two changes, I don't think that bill did much in terms of affecting the medical cannabis program.
How many people do we have writing these cards, these prescriptions? It's not a prescription, but a card.
So I think the Department of Health at the end of last year quoted us at 207 certifiers, but I've heard bigger numbers than that. I think we're over 300 at this point. Angie Calhoun of the Mississippi Cannabis Patients Alliance, she is, she's the patient advocate for the state. She works closely with patients and with certifiers, and I think her number is over 300. So I think that's a more accurate number for the number of certifiers within the
Love
state.
to get her on one day. Just ask her to call us, just to pick her brain on this one.
Yeah, no,
also, what does it cost? Because some people were asking me that. What does it cost to get the card?
So it definitely depends on which doctor you go and see. I mean, obviously, the state, we're not in the business of fixing prices for businesses. These are all privately owned businesses, privately operated. I think the average cost is around $150, and that's for your certification and your 6-month follow-up. And that also includes the fees from the state for processing
Is
that
it
card.
that the doctor visit and the card?
And the card, yes.
So, but the card itself is what? I understand.
I think $25, I think, is the state fee.
The doctor's visit is going to vary.
Yeah.
Anything else? Time is running out here, but anything else you want to put on, or just to alert us to before the time does go?
I don't think so. Obviously, I want to thank you for having me back on. It's always a pleasure to be able to get on and speak to you about this industry.
So 40,000 is the patient total right now. So
44,000. Right under 44,000, I think, was the latest number I saw. And that does not exclude patients or cards that may have not been renewed. I think there's probably between 2,000 and 3,000 patients that have either passed away or didn't renew their card. So we're over 40,000, but we've had 44,000 certified.
Don't be a stranger, sir. Always good for the updates. We need to get them. Let us know what's going on. Thank you, man. Appreciate it very much.
Thank you.
Henry Crisler, Executive Director, Medical Marijuana.